another variable, the amount of time that passes between follow-up visits?
Another variable of what?
That can vary the test results.
Objection vague.
Do you understand what I asked you?
I insinuated to it. I mentioned it. There's definite variable. The longer the provisional, the worse the data.
Okay. And the reason for that is what?
If the implant is solid, okay, then we should proceed with the finalization, because let me tell you why. If the provisional doesn't put the tooth under function and the patient is chewing provides physiology, movement, circulation, bone. This is why the best analogy today in orthopedics, after surgery, they tell the patient, get up and walk. You want to use the bone, you want to use the knee, you want to use the joints. The same thing in the mouth. We want this patient, if the implant is in solid base, solid bone, stabilized, then we should finish the treatment so the patient can function and live normally. Whereas if you use the temporary move and liquids go underneath it, bacteria accumulate and create plaque and bacteria, and you end up with a lot of problems. So it's better to finish the job. That's our opinion.
Okay.
This I cannot tell you, but it looks here that most patients receive the final, which is good. You know, they did get a final ceramic, but it doesn't tell me when.
Okay.
It doesn't tell me when. Was it a month later, 2 months later, 3 months later? If 3 months later, and then I see, for example, page 8.
Which report? July?
Yes. No. I don't know. July, yes.
Okay. Thank you.
Look for page 8.
Patient number?
Patient 22.
Okay.
It says fistula and soft tissue inflammation post-cementation resolved with open flap debridement, loss of dental papilla. See? Now, if this patient had a bad temporary or a very lengthy temporary, which was not nicely contoured to match like nature, okay, that would explain the tissue inflammation. Okay, now, because I don't have the dates here of this, when was, you know, like for example, patient 22, male 53, time placement, when? 1999, 95, 97, 92, you know, when? What month? So I could, you know, intellectually could put in my own mind that if I see that the temporization or provisionalization period was 4 months, which is not explain the fistula. See?
Okay,
I mean, as a reader, that's what I like to see. Or as a co-investigator, I like to see that. And I wish these reports were sent to me overseas.